Hello, and welcome. Today we're diving deep into a relatively uncommon but important heart condition known as sinus exit block, also referred to as sinoatrial exit block or sinoatrial block. We'll explore what it is, what causes it, how it affects the heart, and what can be done about it. So, what exactly causes sinus exit block? In essence, it's a problem with the heart's natural pacemaker, the sinoatrial or SA node. This node generates the electrical impulses that tell your heart to beat. Sinus exit block can occur due to a variety of factors. These include underlying heart disease such as coronary artery disease, cardiomyopathy, or heart failure. Certain medications, particularly those that slow heart rate like beta blockers, calcium channel blockers, and digoxin, can contribute. Electrolyte imbalances, particularly potassium imbalances, and even structural abnormalities in the SA node itself can also be to blame. In some cases, the cause remains unknown, classified as idiopathic. To understand sinus exit block, we need to talk about the heart's electrical system. Normally, the SA node fires an electrical impulse that travels through the atria, causing them to contract. This impulse then reaches the atrioventricular, or AV node, which relays the signal to the ventricles, causing them to contract. In sinus exit block, the SA node may generate an impulse, but that impulse is blocked from exiting the SA node and reaching the rest of the heart. Think of it like a faulty wire. The power is there, but it can't get through. This blockage results in a pause or dropped beat, as the atria and ventricles don't receive the signal to contract. The severity of the block determines how frequently these pauses occur and the resulting impact on heart rate and blood flow. Sinus exit block is not as common as other heart rhythm disorders like atrial fibrillation. Precise epidemiological data is limited, as many cases may be asymptomatic or misdiagnosed. It tends to be more prevalent in older adults, individuals with pre-existing heart conditions, and those taking medications that affect heart rate. Some studies suggest a link between sinus exit block and conditions like sleep apnea, which can contribute to irregular heart rhythms. The signs and symptoms of sinus exit block can vary widely, depending on the frequency and duration of the pauses in heart rhythm. Some individuals may experience no symptoms at all, especially with infrequent pauses. However, others may experience lightheadedness, dizziness, shortness of breath, fatigue, or even fainting spells, known as syncope. In severe cases, prolonged pauses can lead to chest pain or palpitations, which is the sensation of a rapid or irregular heartbeat. If you experience any of these symptoms, especially if they are new or worsening, it's important to seek medical attention. Diagnosing sinus exit block typically involves an electrocardiogram or ECG. An ECG records the electrical activity of the heart and can often reveal the characteristic pauses in rhythm caused by the blocked impulses. However, because the pauses may be intermittent, a standard ECG may not always capture them. In such cases, your doctor might recommend a Holter monitor, which is a portable ECG that records heart activity continuously over 24 to 48 hours, or even longer. An event monitor, which is activated only when you experience symptoms, can also be helpful. Electrophysiological studies, or EPS, which involve inserting catheters into the heart to directly measure electrical activity, are sometimes used to further evaluate the SA node function and confirm the diagnosis. Sinus exit block is often classified by its first degree, second degree, and third degree. First degree block involves a slight delay in the impulse exiting the SA node, but all impulses eventually get through. It's often asymptomatic. Second degree block involves some impulses being blocked, leading to occasional dropped beats. Third degree block, also known as complete heart block, involves all impulses being blocked, meaning the atria and ventricles beat independently of each other. This is the most severe form and requires immediate treatment. Treatment for sinus exit block depends on the severity of symptoms and the degree of the block. Asymptomatic individuals with first or second degree block may not require any treatment at all, other than monitoring. If medications are contributing to the problem, your doctor may adjust or discontinue them. For symptomatic individuals or those with third-degree block, a pacemaker is often the recommended treatment. A pacemaker is a small device implanted under the skin that sends electrical impulses to the heart to regulate the heart rate and prevent pauses. Lifestyle modifications, such as avoiding excessive caffeine and alcohol, and managing underlying conditions like sleep apnea, can also be helpful. Preventing sinus exit block, while not always possible, involves managing risk factors for heart disease. This includes maintaining a healthy weight, eating a balanced diet, exercising regularly, not smoking, and controlling conditions like high blood pressure, high cholesterol, and diabetes. Regular check-ups with your doctor can help identify and manage any underlying heart problems that could contribute to the development of sinus exit block. The prognosis for individuals with sinus exit block varies depending on the severity of the condition and the presence of underlying heart disease. Asymptomatic individuals generally have a good prognosis, with appropriate treatment, such as a pacemaker. Symptomatic individuals can also experience significant improvement in their quality of life. Recent research has focused on improving pacemaker technology and developing more accurate methods for diagnosing sinus exit block. Studies are also exploring the role of inflammation and other factors in the development of SA node dysfunction. These ongoing efforts promise to improve our understanding and management of this important heart condition.